This clip has been created for learning and development purposes. It is intended to be educational and feedback is encouraged. This final clip in the Wellbeing series will look at the use of yoga as a mechanism to reduce stress and anxiety. So far, we have looked at mindfulness through meditation and gratitude and breathing techniques. Yoga is a mind and body practice, focusing on a combination of postures, breathing, and meditation. Yoga brings together both physical and mental disciplines to help you achieve a peaceful state. While there are a variety of yogic styles, this clip will focus on the practice of Hatha Yoga, a common form that uses slower movements, is easily accessible to a variety of ages, and has been proven to reduce stress and anxiety. You may recall from the first clip that Hatha Yoga forms a part of Jon Kabat-Zinn's mindfulness-based stress reduction program. Yoga brings together elements of the first two clips, mindfulness and breathing. The object of attention in meditation is the breath. The object of attention in yoga becomes the body. Yoga can be used to combat the physical and mental exhaustion felt during and after long shifts. As medical professionals, you are always focusing on safe and efficient patient care, communication and collaboration, and continuous learning. We believe that a further element of self-care should be on your radar. Taking care of yourself and taking care of others enhances productivity. Yoga can help you to look after yourself by reducing stress and anxiety. This occurs by modulating the body's stress response system, lowering the heart rate and blood pressure, helping you to calm down. For example, say that you're on shift trying to treat a patient. Are they showing signs of meningitis, or could it be just a cold? At this stage, you might be feeling tired and stressed trying to treat this patient, but also knowing that you have at least 10 more to see before you can even consider dashing off for the bathroom or grabbing a quick bite to eat. Then, as you're just about to move on from this patient, a surge of new patients, including a trauma, rush through the hospital doors. There is no training for this sudden surge of stress and emotion. The physical, emotional, and psychological demands of the job can leave you hunched and tense from the day's events. Yoga is a self-healing mechanism and can be used instead of other maladaptive coping strategies. Yoga is also preparation for meditation, using movement to allow the flexibility to sit in meditation for longer periods of time. We will now run through some examples of yoga postures that can be used to relieve stress and tension in certain areas, and can be done quickly if you're pressed for time. The first pose is downward facing dog. Downward dog is one of the most common yoga poses. It stretches the chest, hamstrings, and calves. The benefits of this pose include a decrease in back pain as a result of strengthening the back and shoulders, a deepened respiration, and a decrease in tension and headaches, achieved by elongating the spine and neck. The second pose is cobra pose. This pose stretches the hips, chest, back, and shoulders. Its benefits include a decrease in lower back stiffness, improved blood and oxygen circulation, and stress and fatigue relief. A final pose is Warrior One. This pose stretches the chest, hips, and adductors. Its benefits include improved mental focus and improved balance and stability. The pose also energizes the entire body and promotes good circulation and respiration. Meditation, as we have discussed, is a great tool for reducing stress and anxiety levels. One thing missing, however, is the element of community, and yoga can fill this gap. Yoga can be done alone or in groups, in person or online, making it very easily accessible. Some links to some yoga sessions on YouTube are 30-Day Yoga Camp and Ali Kaminova's Easy Hatha Yoga. We hope that you have enjoyed and taken something away from this last clip on yoga. The purpose of this series of clips has been to care for the carers by introducing coping mechanisms to deal with stress and anxiety. The first clip looked at mindfulness through meditation, with a focus on the present moment. The second clip looked at gratitude and breathing techniques as mechanisms to improve well-being. This final clip on yoga brings together elements of the first two clips, mindfulness and breathing techniques. We hope that you have benefited from these clips and will pass them along to your peers. Please remember, all feedback is encouraged.